Welcome to the Health Conditions YouTube channel. Today we are discussing alopecia. Alopecia is a medical condition characterized by hair loss from the scalp or body. It can be a result of various underlying causes, including genetics, autoimmune disorders, hormonal imbalances, and certain medications. Alopecia can manifest in different forms and patterns, such as patchy hair loss, alopecia areata, pattern baldness, androgenic alopecia, and complete loss of hair on the scalp, alopecia totalis, or the entire body, alopecia universalis. The type and severity of alopecia can vary, and treatment options depend on the underlying cause of the condition. Alopecia can have a significant impact on a person's mental health and well-being, as hair loss can be distressing and affect one's self-esteem and confidence. Some people with alopecia may experience social stigma and discrimination, which can further compound their distress. In severe cases, alopecia can also lead to complete hair loss on the scalp and body, which can be physically and emotionally challenging. Treatment options for alopecia vary depending on the type and severity of the condition. Some forms of alopecia can resolve on their own without treatment, while others may require medical intervention, such as topical or oral medications, immunotherapy, or hair transplant surgery. In some cases, hair loss may be temporary and hair regrowth may occur naturally. However, in other cases, hair loss may be permanent and the goal of treatment is to manage symptoms and improve quality of life. Forms of alopecia include alopecia areata, an autoimmune disorder where hair loss occurs in patches on the scalp and sometimes on other parts of the body. Alopecia universalis, a severe form of alopecia areata where all hair on the scalp and body is lost. Alopecia totalis, complete hair loss on the scalp. Androgenic alopecia, male, female pattern baldness, a common type of hair loss that is genetically determined and occurs due to hormones and aging. Scarring alopecia, also known as cicatricial alopecia, a type of hair loss where scarring damages the hair follicle, leading to permanent hair loss. Telogen effluvium, temporary hair loss that occurs due to a shift in the hair growth cycle caused by stress, hormonal changes, or certain medications. Traction alopecia, hair loss caused by repeated pulling or tension on the hair, such as tight braids or ponytails. Frontal fibrosing alopecia, a form of scarring alopecia that mainly affects postmenopausal women and causes hair loss at the frontal hairline. Tinea capitis, scalp ringworm, a fungal infection that causes hair loss and scaliness on the scalp. Anagen effluvium, rapid hair loss caused by damage to the hair follicle matrix, often as a result of chemotherapy or other medical treatments. Trichotillomania, hair pulling disorder, a psychological disorder where a person has an irresistible urge to pull out their own hair. Monilethrix, a hereditary condition where hair shafts are abnormally formed, leading to hair breakage. Loose Anagen syndrome, a condition where the hair shaft easily becomes loose from the hair follicle, leading to hair loss. Tufted hair folliculitis, a rare condition that causes tufts of hair to be lost, leaving scarring on the scalp. Folliculitis decalvans, a type of scarring alopecia that primarily affects men and causes hair loss and scarring on the scalp. Pseudopelade of Brock, a type of scarring alopecia that presents as small, circular patches of hair loss on the scalp. Aplasia cutis congenita, a congenital condition where there is a missing patch of skin and hair at birth. Confluent and reticulated papillomatosis, a skin condition that primarily affects young women and causes scaly patches and hair loss on the trunk and extremities. Acne keloidalis nucci, a type of folliculitis that primarily affects the back of the neck and causes keloid-like scars and hair loss. Discoid lupus erythematosus, a type of autoimmune disease that primarily affects the skin, causing scarring and hair loss on the scalp, face, and other areas. Lichen planopilaris, a type of scarring alopecia that primarily affects women and causes hair loss and scarring on the scalp. It's important to note that not all of these conditions are classified as alopecia by every medical professional, but they are all types of hair loss or scalp disorders. The most common forms of alopecia are androgenic alopecia, male, female pattern baldness; alopecia areata; telogen effluvium; scarring alopecia, cicatricial alopecia; traction alopecia. Although treating alopecia is not always successful, there are various treatments available depending on the type of alopecia you are trying to address. Treatment options for each type include alopecia areata, medications, topical minoxidil, corticosteroids, anthralin, dithranol, immunotherapy, contact immunotherapy, squaric acid dibutylester, and other treatments, wigs, hairpieces, hairstyling. Alopecia universalis, medications, immunotherapy, and other treatments. Alopecia totalis, medications, immunotherapy, and other treatments. Androgenic alopecia, medications, topical minoxidil, oral finasteride, hair transplant, scalp micropigmentation. Scarring alopecia, medications, corticosteroids, immunosuppressants, scalp biopsy, hair transplant. Telogen effluvium, addressing the underlying cause and medications, minoxidil, oral contraceptives. Traction alopecia, addressing the cause, altering hairstyle, medications, minoxidil. Frontal fibrosing alopecia, medications, topical minoxidil, topical corticosteroids, immunosuppressants. Tinea capitis, antifungal medication. Anagen effluvium, addressing the underlying cause. Trichotillomania, behavioral therapy, cognitive behavioral therapy, habit reversal training, medications, antidepressants, antipsychotics. Monilethrix, hair transplant, hairpieces. Loose Anagen syndrome, avoiding hairstyles that pull on hair, hairpieces. Tufted hair folliculitis, medications, antibiotics, corticosteroids. Folliculitis decalvans, medications, antibiotics, immunosuppressants, hair transplant. Pseudopelade of Brock, medications, topical minoxidil, corticosteroids. Aplasia cutis congenita, wound care, skin grafting. Confluent and reticulated papillomatosis, medications, retinoids, antibiotics. Acne keloidalis nucci, medications, corticosteroids, antibiotics, surgical removal. Discoid lupus erythematosus, medications, corticosteroids, immunosuppressants, antimalarials. Lichen planopilaris, medications, topical corticosteroids, immunosuppressants. If you suspect you have alopecia, it is recommended to see a dermatologist for a proper diagnosis and to discuss the best course of treatment for your specific condition. The dermatologist may perform a physical examination, medical history review, and possibly a skin biopsy to determine the type of alopecia and the most appropriate treatment plan. Thanks for watching, and don't forget to like and subscribe for more informative videos like this one.